everyone, and welcome to this discussion of advancing health equity in the United States. Dr. Maybank, thank you so much for coming on the show. I'll start with this. So I did not know that New York City had a Center for Equity, and I'm very proud. Although embarrassed, I am proud that we do have a Center of Equity. So why don't you introduce yourself to the audience?
Hi everyone, Aletha Maybank, Dr. Aletha Maybank. I am the founding director for the Center for Health Equity as well as Deputy Commissioner here in the New York City Department of Health. And don't feel badly. The center has only been around really now for about a little over 3 years. So we are new to the city. We've had other kind of iterations beforehand in Office of Minority Health, but really, the evolution in the field of health equity has been to really use that term and not minority health. And so now that we've been around for 3 years, and really when Dr. Bassett came on board, who's our current health commissioner, Mary Bassett, really wanted to make sure that we as an organization and institution, explicitly talked about health equity and found ways of how we need to evolve our work as a health department to truly ensure that we're advancing health equity. And not just to talk about differences in data, which are very important to highlight the differences and the distinctions. That's really the core reason of why a Center for Health Equity exists, is because of the gaps that exist. And they can exist by neighborhood. We focus a lot about the racial inequity, which is aligned with neighborhood and class as well.
So what is the role of the Center for Equity in the New York City Public Health?
Sure. So the Center for Health Equity, just to be more specific, is to really highlight and work towards eliminate the disparities that exist, but making sure that we're doing it with the lens of understanding how these inequities came to be in the first place. So really understanding the historical injustices as they're related, especially to policy, and how they have determined how people can live, where people can live within the city, what resources and opportunities that they have access to, and how all of that impacts a person and a community's health. And so our role is to really, as a government entity, take responsibility for that and acknowledge that and figure out what is it that we need to do internally in our agency to dismantle this history. It's not easy, as most folks have an awareness of, as we talk about racial inequity in this country as a whole. Talking about racism is very hard and difficult for most Americans. Most Americans aren't well equipped to talk about it because they don't really have a language for it that's kind of shared, and they don't fully really understand the history about race, but also about racism and the distinctions between the two. So a lot of our work is really looking at the agency. So we initially called it an internal reform process that now we have labeled as Race to Justice. And so this is our effort to figure out how do we best normalize conversations around race, power, and privilege within the agency. So that looks like, hosting sessions and having brown bag lunches, of which we have highly coveted speakers who come in and recognize for the work and their leadership that they do. But we also have very distinct and intentional training opportunities for all staff here at the health department. And it goes from anywhere from like an online module of which they can learn about kind of just health equity overall and what determines health equity, what are the determinants of that, and then also a full day course that really speaks more towards the racial equity piece of it and the history around race and racism and policies that government put forward. And then we've created some, communities of practice as well across the agency. So all of that's how do we normalize? And then there's another part of how do we organize? This is a large agency where almost 7,000 employees. It's one of the largest health departments in the urban world. And, how do we organize ourselves? What's the infrastructure that needs to be created? One, to make sure that this process is inclusive of the many voices around the agency, but also to help start building it into kind of the existing infrastructure of the agency. How does it become a part of what it is that we do from here until whatever? And then the last piece is how do we operationalize? And that's a lot about what are the tools that our teams and individuals need to kind of put in front of them so that they can challenge themselves on how they typically do their work. Because we find that even after some of the training and the full day training, and you kind of have this consciousness that's created, you're starting to develop a language that you're able to talk to and talk with people. It's like, so what do I need to actually do to change my work and how I do the work? So it's having tools that are present. We've created a community engagement framework in order to understand the different levels of community engagement and what we want to do. We're working on a racial equity tool in which every single division within the agency can look at as they're starting to develop their goals and objectives for the year. We're going to have some communication tools as well. So there's a lot that needs to be provided in order to do this internal reform work. So that's a big chunk of our work. It's not the only part of our work. And then the other piece is, the other big piece, I would say, is the work that we have within the neighborhoods of New York City. So we have, in 2015, we put forward what we call community health profiles. And those are community health profiles in every single community district. Community districts are our most local level opportunity for governance. And so it actually provides data on health outcomes, but also which people typically think about health outcomes and diseases, but it also looks at some of the social determinants. So school absenteeism and incarceration rates within communities and neighborhoods. And really, what's been great is that we have, with many people in the agency, have used them as organizing tools in a way with our local partners so that they could, one, see what's happening in their neighborhood, but two, figure out what's the action behind what they can do in order to help change or evolve, but also how can they use them as advocacy tools to elected officials or to get grants or whatever. So it's really what's important for us as an agency, and what we've always done really well here in New York City is putting data in the hands of people so that they can use it. But as we look at that data, we're very clear that there are neighborhoods that definitely have the worst health outcomes, the worst life expectancies, and a lot of it's due to what I mentioned earlier because of the policies and practices around investment and disinvestment within most cities. And how it's been, the underlying piece of it has been rooted in racial and racism. I was going to say racial inequity and racism. And so that's created areas across the city that we know have the worst health outcomes. So what we've done is placed local offices within those neighborhoods that have actually been around for almost 100 years. It started right before the LaGuardia era, in the early 1900s. And so we've reimagined these buildings and assets that the health department has had for years and launched neighborhood health action centers, which are co-located models of medical providers, community-based organizations, other city agencies within the same roof to think about not only just the services that they're delivering, because a lot of times there are services, folks refer to sometimes these neighborhoods as underserved areas, and that's not really the correct narrative. Disinvested areas, absolutely. Oftentimes there's lots of services, but they're not really coordinated well, they're not working together, because people are funded in different ways. And so our opportunity as a health department is to figure out how can we pull people together to think about planning for the neighborhood that has a better level of coordination of what is existing and the current assets so they work better and they're optimized for the residents that are there. In addition to it's not that investment is not needed, I'm not saying that, but it's clear that there's a lot that also is happening in our neighborhoods that is just not working well together. So that's the big intention of the Neighborhood Health Action Centers, and this is to be an asset that we have as a health department that's rooted right in our neighborhoods. They call it place-based or neighborhood-based opportunities for engagement. And within the buildings, there are physical activity spaces, there's multimedia rooms, convening rooms. Any group wants to have a meeting, they can have a meeting within the room. And then we also have like a women's wellness suite or family health suite for families, and really focused on how best and how better can we help support moms and families for them to have healthy outcomes, especially as it relates to delivery and birth, but also for their babies, and so that they live past their first year of life.
That's really amazing. I've been speaking with people in the public, and just there's this miscommunication in terms of the resources that are available, and the knowledge of those resources that are available. So I hope that everyone's watching, and I hope that you've listened to what Dr. Maybank has said, and try to utilize those resources that are within the community.
Right. Yeah, I mean, and you're absolutely right. I think we are responsible for that, definitely in terms of the health department and making sure we get out that information. And what's been really pretty, I think, remarkable and awesome is that we've put out lots of press releases. I've been here since 2009 in the health department in a different role, but I've seen so many press releases go out for the last 3 years of just putting out what is it that we're doing so that people can have that information. And that's just one way. But also, writing in different places. Commissioner writes, other deputy commissioner writes. They write in popular media spaces. I've written participation on, shows, media, whatever it is. I think we have to, as a health department, and sometimes government is considered kind of wonky, and we don't really do those kind of things, but you have to evolve and be able to connect with where people are at and where they're getting their information nowadays. So, and using social media as platforms for many of us to really share the information, and just even to provide comment and narrative. That's a big part and role that we can play as a health department about what really creates and shapes health. It's not just about what happens in a doctor's office. And I think a lot of people are starting to folks understood that, I feel, because you have a sense of what makes you healthy in many ways, but a lot of folks think it's doctor's offices. So I do think there's an evolution and a switch to people understanding that where you live, the kind of house you have, having a job, your income, all of these things impact health. And then we are elevating that systems that are equitable by race and other power structures also impact health and are important for building healthy communities, or dismantling those are important for building healthy communities. Okay. So the more we can put that voice out, the more we can tell the story. So that's a part of our work. How do we make injustice visible?
Those specific initiatives to target health inequities in neighborhoods.
In addition to a large part of kind of our focus and our drive is how well are we working with our partners to engage and to develop models of which that engagement feels more equitable and inclusive as government. But also we have specific topic areas based on the data that is very clear for the area. So we know asthma rates are higher, asthma hospitalization rates and ER visits are higher. So we have programs, and we have catered to that, and we have a East Harlem Center for Excellence related to asthma. We have teen pregnancy prevention work, which has been highly successful, however at tremendous risk right now, because that program and the funding is potentially getting cut. So far we know it's getting cut at the federal level. So if that finally goes through, then a lot of cities are not going to have money to do teen pregnancy prevention, which isn't just about condom use, definitely is not about abortion, but it's really about young kids really understanding their rights of what they have access to, literally what they have access to depending on wherever they live in the city, but also building a sense of self for, among each other, as a collective, but also how does that build a sense of self-worth for themselves? How do they become voices and leadership in the area of reproductive justice and reproductive rights? And then how are we working with clinical providers to connect better with schools so young people are more likely to go to their doctors and connect with their clinicians? So there's lots of work and great opportunity with teen pregnancy prevention programs here in New York City. And then we have a focus on maternal health. We know that Black babies are 2 to 3 times more likely to die than white babies in New York City, so that gap is still there. We have a strong push in New York City and work and a lot of players, and it's building even more to close that gap. But also pretty distressing is for Black mothers, and 3 times more likely to have complications around the time of pregnancy and 12 times more likely to die as a result of pregnancy, which is really kind of higher, which is higher than the national average. So there's a lot of work that we still have to do. A lot of what we're doing is urgent. It's important, but we still have a long way to go. It's a tremendous injustice to hear that, and it actually causes me anxiety, truthfully.
Yeah.
As a Black woman myself, to hear those numbers, and honestly, the more and more we learn, it's about the systems that we have set up and how well they're valuing or not valuing the lives of people.
Yes.
And the voices of people.
I agree. Another big issue that is impacting communities, at least when I've spoken to people in the streets, is diabetes. And so people are saying diabetes is such a big problem. So do you mind touching on some of the initiatives that you guys have taken to address diabetes in the outer boroughs?
Diabetes is definitely a tremendous issue in many parts of this country. Often it's very much connected to our epidemic of obesity and overweight. And there are multiple factors. A lot of the early conversation was really about behavior and, what a person is doing themselves, how are they taking care of themselves, genetics. And, we've learned and really fully accept that public health point, that your behaviors are very much in line with what's happening within your environment. So whether it's your familiar environment, it's your living environment, your built environment, or the environment of who influences what you buy, And so there are many levels at which we have worked at addressing obesity as well as diabetes, because they're somewhat connected and linked. And they are connected and linked, not even somewhat. And so, we have had programs, that work with providers. So New York City is one of those cities that actually collects information on uncontrolled, or actually all of them, hemoglobin A1C levels, which is a marker of how well or not well your glucoses have been controlled if you have diabetes. And so we have a registry. So it's one way that we've been able to collect information and then map it to see kind of where in New York City do most people live with uncontrolled diabetes. And so from that, we've been able to kind of create programming and target programming there. So we have in East Harlem a program called Harlem Health Advocacy Partners, and it's a community health worker program, but what's very unique and different about it is that it's actually rooted in the neighborhood, in NYCHA developments, as opposed to most community health worker programs start within the clinical setting and then folks go out. But this is actually community health workers starting within the NYCHA developments, or New York City Housing Authority developments, and then kind of connecting the other way. But a lot of that, we used hotspot data, what we called it, to uncontrolled diabetes to kind of target. And so there's coaching that's happening, but there's a lot of collective activity and organizing that's happening at the local level. So that's how we collect data, is an important way of understanding what's happening within New York City. And we have other ways in which we collect data to understand diabetes and obesity. And then how do we connect that to programmatic work is one thing. We've also done, as many folks are familiar with, our campaigns around obesity as it relates to pouring on the pounds. New York City is very much known for the last 2 administrations to do work that is very cutting edge in terms of messaging, and really sparking the awareness and the connection of obesity and sugary beverages. And that work, I think New York City Department of Health can take lots of credit for really helping create that connection for not only just the New Yorkers, but for Americans to really take a second look at why are they picking up that soda bottle. And so we still evolve, and we're still working on those types of campaigns and figuring out what do we need to do next. We have done work with organizations in training community-based organizations across the city about marketing tactics that many corporations are using that target especially Black and Latino youth to buy their products that are unhealthy, sugary, and unhealthy.
Yeah.
So we called that "We All Want Healthy Children" as a campaign. So we're continually evolving and growing that work as needed. It's important.
Amazing. So for people that are living in communities with high health disparity rates, how do they go about uplifting resources to uplift themselves socially and economically?
So we typically want to blame the individual and blame the communities for what's happening, and then we have this expectation that people need to lift themselves up and that they're responsible for not only the situation that they're in, but then they're responsible for the solutions. Now, agree that there is a responsibility on all of us to figure out and to move towards better health and better opportunities within our communities, and ways in which we can use our power, all of us, in order to improve our own lives as well as our communities' lives. But I think it's a very important distinction to really recognize, again, the role of government, the role of organizations and institutions and policies, and how all of that a lot of times makes it very difficult for folks to fully harness the power that they have in order to create health that's good in one community, such as Brownsville, as compared to the financial district. You know, when you have investment that you don't have as much control over, like what are you supposed to do? You know, that's frustrating for people. It's tiring for people. It's traumatic. They have to worry about their day to day, you know, of how they're going to go to get to work, maintain a job, take care of their families. You know, there are lots of other pressures upon many of our residents within our neighborhoods that are experiencing the worst health outcomes, you know. And so I feel part of our work, and a large part is how do we shift that narrative, like of who's responsible. And it's not just the people who live within those neighborhoods, you know, it's not, you know, they oftentimes have no choices, or the choices that they have are not the same choices that even I have, you know, maybe some at times. But even I, being a Black educated woman, still experience inequities as it relates to systems and institutions who discriminate towards people of color, no matter what your educational background. We still have, as well-educated Black women, high infant mortality rates and high death rates during delivery and pregnancy. So we have to switch towards that narrative. In terms of when we engage with our residents and at the neighborhood health action centers, our teams, definitely they work to share the data, but we're very careful about that because I feel, and I'm feeling it more now because I am hearing the data as it relates to Black women and educated women, that's anxiety provoking, you know, and it's not always really that motivating. It's not. And I think I think folks within our neighborhoods have an awareness that their health isn't as good as maybe somebody else, or that they don't have the same opportunities as another neighborhood does in New York City. So what is it that, we can do? And one is oftentimes folks in our neighborhoods don't have the opportunity to have their voice shared. It's not that they're not speaking up, and it's not that they're quiet. I don't feel that happens at all. It's just who hears their voice and who pays attention and who is willing to listen. And so we have an opportunity at the health department to use our power to help elevate or share the stories of what people are actually experiencing. Because stories tend to move people more so than data does. And so if we can get those stories out, whether it's in popular media or through some of our reports that we do, getting them to elected officials, then we may have some ways of influencing people that we hadn't, particularly considered before. And then the other piece is, how do we also work with neighborhood voices to change how we do our work and influence how we do our work as the health department? And so that's, we encourage folks, honestly, to be civically engaged. And because that's where their power potentially is, as much as we can. I'm not saying even civic engagement is not equitable, right? And is not optimal across this country, or the opportunities to be civically engaged. However, there are some. And so that's part of our message too, that we know there are civic determinants to health. And so if we can help support people voting, helping with whether it's registration or getting people out to vote, using 311 and having that message out there, because our neighborhoods don't use 311. And oftentimes folks feel they may complain, but nothing happens sometimes. That's the feeling. And sometimes, and the reality too, as compared to other neighborhoods maybe. So the civic engagement piece is part of it. So those are the ways in which, we work with neighborhoods and the messages that we put forward.
How can millennials take an active role in advocating? Yes. How do we reach young people? How do we get them motivated?
So how do we reach millennials? So I am not a millennial. Okay. I would love to think I was a millennial, but I have to accept that reality that I'm not. And I think and I say that to say, because I think it's important to ask millennials how they want to be engaged, and not make assumptions, especially folks in my generation. Like I'm the next generation up, right, from millennials, that we don't make assumptions about how to engage them and what they want to do. And so what we are building out in the center, we've done several efforts around this, is engage millennials in the work that we're doing. Our teen pregnancy prevention work is definitely engaging millennials so that they guide what it is that we do. But it comes back to the same, what I mentioned before in terms of civic engagement. And millennials have lots of power, and lots of voice, lots of ideas, lots of energy. And it's important for us in government, and also folks of my generation, to recognize that and to value that and find ways of valuing that by actually integrating voice into what it is that we do, to help influence what we do. That is my advice, and it's more so for my generation in government. I hesitate to say what millennials should do, because I'm not a millennial, and I think that they have a voice and they have an idea of what they want to do. But civic engagement, I think, is absolutely crucial in terms of impacting health.
Last words on how the people of New York City can engage in government and engage in advancing health in their respective communities.
Right. So I think in New York City, we're set up really well. And not that we don't have opportunities for improvement, but we have several policy documents. So I think it's important for folks, if you want to become civically engaged, is to really start to understand what are the policy documents that are currently out there that are to be guiding New York City work, right? And these documents oftentimes we've put out as government. So there's one NYC that was put out by the mayor during his first administration. And there's been build-up of, and accountability of city agencies to make sure that we're meeting those indicators of what we were going to say in New York City. But I think it's very important for people to kind of look at those documents. We have a Take Care New York health policy for New York City. And so for folks to just look at them, and they're not hard to go through. If even high school students honestly could engage around them, if they're teachers or educators. And then we have our community health profiles, again, which are data. So you could go to our website and look up the neighborhood you live in and see what is happening as it relates to health within your neighborhood. It's just information that you have to better understand your neighborhoods, to better understand New York City, and then figure out, one, how do you hold New York City accountable for what is it that we say we're going to do. Information you can go to your elected officials or write your elected officials about to say, hey, these things are supposed to be happening. Or maybe what you see in your neighborhood is not even a part of any of these documents. And so then what can you then say to your elected official and advocate to your elected official? But also then how do you come together collectively with people that you know, whether it's in your household or your school or your neighborhood, participating in your community board. All of this work, as we know, is definitely much stronger and much more powerful when we come together as a collective in order to fight for something and to advocate for something.
So what are some hashtags that the Center for Equity have out there for people to become more engaged in government?
So we have, we have our hashtag NYC Health Equity. We have our hashtag Our Healthy New York City. And then we just recently launched a hashtag called hashtag Neighborhood Voices NYC that again speaks to how do we help push and share the voices of those who are experiencing the burdens or leading the work within New York City from our neighborhoods. So those are the three.
Great. So when you speak of getting engaged, that's definitely a great way for folks to get engaged. Absolutely. And is the responses from those hashtags, are they taken seriously?
Yeah, I mean, we have a team that definitely responds to hashtags, social media. There are many different ways in which people can connect with us and share whatever it is they want to share. We have a website, yes, and then we also have an email address. So I feel the health department has done a great job at being very accessible to New Yorkers and the administration overall, but to New Yorkers, and we take it seriously.
Thank you, Dr. Maybank, for your time and for helping to contribute to this discussion of advancing health equity in the United States. I am proud to be a New Yorker and to be of a city that has a center of equity to begin with. So thank you, Dr. Maybank.
You're welcome.